Hello, and welcome back to Module 1, Introduction to Abnormal Psychology. This is Lecture 2, Overview of Assessment, Diagnosis, and Classification. Before we delve into specific presentations of psychological abnormality in the upcoming modules, it's important for us to spend some time discussing the frames we use for identifying and understanding psychological abnormality. For that reason, the rest of this module will cover assessment, diagnosis, classification, conceptual models, and treatment approach. In this lecture, we will look at assessment, diagnosis, and classification. First, let's consider assessment. Assessment refers to the process of collecting information and drawing conclusions about the nature and severity of a person's psychological struggles. Assessment takes many forms, including lengthy clinical interviews, psychological tests, naturalistic observations, and collateral reports. All of this information must be filtered through a thorough, nuanced understanding of the person's family, social, and cultural context, as well as the multiple facets of their unique identity, including but not limited to gender, age, religion, race, ethnicity, sexuality, income level, acculturation, and ability status. Even though the process of formal clinical assessment involves a concrete set of tools and procedures, it's important to remember it is not a one-and-done, one-time set of procedures. Rather, it is a complex, nuanced, dynamic, ongoing process. Following the conclusion of the initial assessment process, the mental health professional should have enough information to determine whether the person is struggling with a psychological disorder. The process of utilizing assessment data to determine the presence of a psychological disorder is called clinical diagnosis. Clinical diagnosis should help the mental health professional better understand the potential progression and outcome of the person's struggles, as well as assist them in the development of an appropriate treatment plan. It's important to note that a person need not be diagnosed with a psychological disorder in order to participate in and benefit from mental health treatment. All people struggle at times in their lives, although not all people develop psychological disorders. Many people who struggle find treatment in the form of psychotherapy or medication to be helpful as they navigate their struggles. The mental health profession utilizes a formal classification system to conceptually organize psychological disorders. In the U.S., a classification system called the DSM, or Diagnostic and Statistical Manual, is in use. There have been multiple versions of the DSM, with the first version being published in 1952. The version currently in use is the DSM-5, and it was published in 2013. The DSM outlines several major aspects of psychological diagnoses. First, a diagnosis consists of a list of criteria and descriptors. The criteria for a particular disorder are symptoms that have been found to be predictably and consistently present in people who struggle with the disorder. For example, low mood, loss of pleasure, poor concentration, and disruptions in sleep and appetite are all criteria for major depressive episode. A second fundamental component of a clinical diagnosis is subtype and specifier. Subtypes and specifiers are used because a particular psychological disorder can always present in different ways across different people, necessitating language that describes the disorder in a more nuanced, detailed way. This adds greater specificity to a diagnosis. For example, the diagnosis of PTSD, post-traumatic stress disorder, has a dissociative subtype. When this designation is given, it indicates that the person with PTSD is struggling with significant dissociative symptoms. The DSM requires that a principal diagnosis is identified when there are multiple disorders present. The principal diagnosis is generally the disorder that the individual is struggling with the most and is likely the main focus of treatment. For example, a person may be struggling with major depression as well as generalized anxiety disorder. The principal diagnosis will be the disorder which is proving more debilitating to the person. Finally, the DSM directs mental health professionals to identify whether a provisional diagnosis is present. A provisional diagnosis is assigned if a person is struggling with some symptoms of a psychological disorder, but not enough of them to warrant a formal diagnosis. The DSM-5 is partitioned into multiple categories of disorders, A full list is found in the readings for this module. It is far beyond the scope of this course to include an overview of all the categories. Instead, we will consider a few of the most commonly experienced categories of psychological disorders. Mood disorders, including bipolar disorders and depressive disorders, anxiety disorders, stress and trauma-related disorders, and schizophrenia spectrum disorders. While the DSM-5 is in widespread use in the U.S., this system is less commonly used throughout the world. The World Health Organization uses a manual called the ICD, the International List of Causes of Death. The ICD series was first published in 1893. The current version in use is the ICD-10, which was published in 1990. In our next few lectures, we're going to look at the major models for understanding psychological disorders, as well as the ways in which each model approaches treatment.